Hello, this is about the new Perio classification. This classification has been brought in to allow some consistency with both diagnosis and management of periodontal patients. There's normal forms of periodontal disease such as necrotizing gingivitis or manifestations of systemic disease, and then you have periodontal disease, which is what this new classification relates to. And it gives us 4 areas that we need to cover. In overview, take your history, your examination, do your BPE as you would with all your new patients or your existing patients, cover oral hygiene in the same way as you would normally. If you have a code, BPE code of 0, 1 or 2, you would just carry on as you do currently with a diagnosis of perhaps gingivitis, maybe oral hygiene instruction, removal of plant retentive factors, etc. A code of 3 or a BPE of 3, the important factor here is that there are appropriate radiographic assessments. A lot of this new classification is based around radiographic evidence. So your pocket chart or your BPE of 3, you would continue with a 6-point pocket chart in the involved sextants and carry on as you would normally. Your BPE of 4 is where this new classification comes in. Again, x-rays are going to be vital. You then would move through this new pathway. The first is the extent of the periodontal disease, be it localized up to 30% affected or generalized of more than 30% of teeth affected. There's also a more distinct molar incisor pattern that would be apparent radiographically, and that's a different classification to the extent being local or general. Then you would have a stage. This is the severity of the disease at presentation and is based on probing depths, furcation, mobility, etc. The results of any of these classifications are based on the worst area seen on your x-rays. So the stages are 1, 2, 3 or 4, depending on the amount of bone loss seen. And an easy way for it to be classified is less than 15%, the coronal third, the mid-third, or the apical third of a tooth being ranging through from mild through to moderate. So you would give somebody a classification of, say, stage 3, if you know that you've lost bone in the worst site that you can see up to the mid-third of the root. And here's some examples of what you might see on the x-rays, whether you use an OPG, whether you use PAs or vertical bite wings, but the x-rays are now vital for this classification. And you can see here examples of severe, mild to moderate. The grading is the rate of progression. This is giving a risk assessment of how this disease may progress and anticipate the outcomes. It also allows a clinician to incorporate individual factors for each patient. So the grading is based on percentage of bone loss divided by the patient's age. Although this seems complicated to begin with, it soon becomes quite easy to work out whether this patient has a slow, moderate or a severe rate of progression. For example, if you have a 30% bone loss in a 25-year-old, that's going to give you a calculation of 1.2 and a severe rate of progression, whereas 30% of bone loss in a 70-year-old would be a slow rate of progression. And then stability. Stability is based around bleeding on probing, whether there are still pockets. So an unstable patient would still have bleeding on probing or deep pocketing, whereas somebody who's undergone successful treatment, you may find that there's no more bleeding. They may still have some bone loss, but the no bleeding would suggest that their perio is stable. So even with signs of recession and bone loss, it could still mean that the mouth is stable. And then risk factors such as smoking and diabetes need to be factored in for each individual patient so that this classification becomes much more of an individual. In summary, you would do your initial assessment, your BPE. A BPE of 4, you would immediately start this new pathway classification, or a BPE of 3 not responding to treatment, so 3 months after that initial diagnosis. And then you would give them these 1 to 5 classifications per patient. So a diagnosis may read general periodontitis, stage 3, grade B, currently unstable, and a risk factor of smoking. This then obviously has to be written down and recorded in good clinical notes, and this is the type of thing that you may see with the x-rays, the pocket charting, and the classification. So a good template would be useful, and a flowchart is available on the British Periodontal Society website.